Remedies for heartburn. Heartburn has nothing to do with your heart, despite what its name might suggest. Instead, a burning pain in your chest is caused by stomach acid backing up into your esophagus, the 10-inch tube that connects your mouth to your stomach. Heartburn can strike suddenly and last for a short while, or for several hours. It is uncomfortable in any case, so it's not surprising if you are looking for a quick fix and found our video. And we are here to assist you in learning how to stop heartburn. What would be the fastest way to get rid of it? Maybe we could stop heartburn. Please subscribe to our YouTube channel, hit the like button, and leave a comment below. Let us first learn the causes of heartburn and how it actually feels. The American College of Gastroenterology claims that your stomach has no trouble processing the stomach acid that is required to break down the food you eat. On the other hand, it aggravates your esophagus. The lower esophageal sphincter, which is a circular ring of muscle at the base of the tube, functions as a valve to keep stomach acid in your stomach and out of your esophagus. The food you have consumed can pass through to your stomach when this valve is relaxed. This valve prevents food and acid from backing up into your esophagus when it is contracted. Acid reflux happens when this valve relaxes abnormally, allowing stomach acid to flow back into your esophagus. The most well-known and obvious symptom is heartburn. Sometimes, an underlying medical condition or even a medication you are taking can cause acid reflux and heartburn. However, they are typically brought on by factors like your diet and lifestyle decisions, which makes the occasional attack of heartburn fairly common. In this case, here are 9 methods to lessen or perhaps even prevent your symptoms if you are trying to prevent acid reflux or quickly get rid of heartburn. Number 1. Keep a food journal and avoid trigger foods. As previously mentioned, specific foods and beverages can cause heartburn and acid reflux. By keeping a food and symptom log, you can help identify the specific foods that are most likely to cause you problems. Once you have identified them, try your best to stay away from those foods and beverages. Number 2. Resist the urge to overeat or eat quickly. Being mindful of your mealtime portion sizes can help prevent heartburn. Large amounts of food in the stomach may increase pressure on the valve that prevents stomach acid from entering the esophagus, increasing the likelihood of acid reflux and heartburn. If you frequently experience heartburn, think about eating more frequent, smaller meals. Eat slowly and take your time to chew your food. And drink your liquids because eating quickly can also cause heartburn. Number 3. Avoid late meals, snacking before bed, and eating before exercising. A full stomach while lying down can cause acid reflux and aggravate heartburn symptoms. To give your stomach enough time to empty before bed, avoid eating 3 hours before going to sleep. Additionally, you might want to wait at least 2 hours before working out. Number 4. Eat alkaline foods like a ripe banana. A banana has a high potassium content, making it a relatively alkaline food. The Academy of Nutrition and Dietetics also states that it might assist in reducing the discomfort your esophagus feels from stomach acid. However, there is a warning. Unripe bananas are less alkaline, starch heavy, and may even cause acid reflux in some people. So make sure to select a ripe banana. Melons, cauliflower, fennel, and other alkaline foods may also help prevent heartburn. Number 5. Wear loose-fitting clothing. If you frequently experience heartburn, wearing clothing that squeezes your abdomen and tight belts may be to blame. Number 6. Adjust your sleep position. While you sleep, elevating your head and chest above your feet can help prevent and relieve acid reflux and heartburn. This can be accomplished by raising the bedposts with wood blocks or by placing a foam wedge under the mattress. Piling pillows often aren't effective and can even exacerbate your symptoms, so avoid doing it. Additionally, it is believed that sleeping on your left side will help with digestion and may lessen acid reflux. Number 7. Take steps to lose weight if you are overweight. Being overweight increases the pressure on your stomach, raising your risk of heartburn and acid reflux. The first two steps to keeping a healthy weight and losing excess weight are eating a well-balanced diet and exercising 150 minutes per week. Number 8. Stop smoking if you smoke. Smoking decreases saliva production and affects the efficiency of the valve that prevents stomach acid from entering the esophagus, which increases the likelihood of heartburn. Giving up smoking can lessen acid reflux frequency and severity, and in some cases, even make it go away. Number 9. Reduce stress. Your body suffers physical effects from chronic stress, including slowed digestion and increased sensitivity to pain. Stomach acid reflux is more likely to occur the longer food is allowed to sit in your stomach. Additionally, heightened pain sensitivity can amplify the intensity of heartburn's burning pain. Reflux and heartburn can be prevented or treated by taking steps to reduce stress. What to do if you have severe or persistent heartburn? In addition, over-the-counter medicines like antacids and histamine blockers can help relieve symptoms of mild, infrequent heartburn if none of these 9 home remedies were successful. Before taking an antacid or histamine blocker, always read the product label and never take more of the medication that is prescribed. If you frequently experience heartburn, talk to your doctor before taking heartburn medications on a regular basis because these medications can interact with a wide range of other medications and have an impact on any underlying medical conditions you may have. Consult your doctor if you experience persistent or worsening heartburn despite taking measures. Heartburn can occasionally be a symptom of an underlying illness, such as gastroesophageal reflux disease or GERD, or it could be a negative drug interaction. So, did that answer the questions at the start of this video? Have you ever had a heartburn? If so, how do you deal with it? Share your thoughts and experiences with the remedies we have shared with you in the comment section below so that others can learn more than just these suggestions. If you enjoyed this video, please subscribe so you don't miss out on future videos. Thank you for watching and we'll see you on our next one.